Hello.
Hello, how are you?
Good. How are you?
I am very well.
Oh, that's excellent. Don't you feel
Yeah,
like a telephone operator from the
either that or like, welcome to McDonald's. May I take your order?
I like mine better.
Yeah, yours is way better.
We have these lovely JBL headsets with
I
microphones
love
built
them.
in.
Yes, they are great with the built-in mic. We are so
Yes.
professional.
Yes. Thank you, JBL.
Yes.
So tell me about your sound bath and your yoga this weekend.
Oh, it was fabulous. It went so, so good. It was exactly what I pictured it to look like. We did it under the huge awning. When you drive up to the resort, there's this huge wooden and iron awning. And we set up right under that. 10 people came, and it was amazing. The sound bath afterwards was so relaxing. And yeah, we just had a really, really good time.
That's wonderful. So
Yeah.
Brandy has a new location, which we talked about in our last episode, but just in case you missed it, it's called the Rockwater Resort. Is that
Yes,
correct? In
the
Little Rock?
resort at Rockwater.
It's
Yeah.
wonderful. She has the spa there and is also the wellness director of the resort, which is
Yes.
amazing. And, you know, that what you're doing there reminds me of this episode today because we're, talking the prescription pad and why that's so important to have in the esthetician room because we're not just doing facials, we're not just doing quick treatments. We're treating the person's entirety. We're going along their skincare journey with them. And with what you're doing now as a wellness director and you're treating the entire body, that is so impressive. I'm super proud of you and I cannot wait to visit.
Thank you. It is going great, and I love it. And I feel like I've found my peace as well. So that's
Yeah,
great.
that's great. Congratulations.
Thank you.
So I guess we can't do a whole lot of chit chat today because we have a special guest. There's going to be three SD besties on today's episode, and Brandy and I both have worked with this person. She's magnificent. We both working with Zeo Skin Health. Our guest is the National Zeo Skin Health Educator, and she has visited Arkansas. She visits all over the nation, but she's trained there in Arkansas, and Brandy's attended her education classes and then here in California as well. So I've attended her classes. So welcome to today's episode, Rebecca Betancourt. She is absolutely brilliant. She's the top of the field here for sure in our field, in our aesthetics field. So we would like to go ahead and bring Rebecca on. Are you ready, Randy?
Yes, let's go.
Let's get started with Pretty Smart Too. Welcome to Pretty Smart 2. Today we're diving into the power of the prescription pad and why creating clear protocols for your patients or clients is the foundation of effective treatment. Joining us is a true industry leader, Rebecca Betancourt, National Corporate Training Executive for Zeo Skin Health. Get ready for insights to elevate your practice and your professionalism. Let's get into it. Before we get started with today's very special episode, please don't forget to like and subscribe. And also, please do share this with your esthetician friends because today's episode is full of amazing information. Hi, welcome to
Hi.
Pretty Smart 2. Today's episode, we're going to be talking all things prescription pad and protocols. I'm Laura Barrow. I'm a licensed esthetician and owner of Laura Barrow Aesthetics in Pasadena, California.
Brandy Kyle, a licensed cosmetologist and owner of Kyle and Company Lash and Skin Studio in El Dorado, Arkansas, and the spa at Rockwater in Little Rock, Arkansas.
We're super excited to welcome Rebecca Betancourt to our podcast. Thank you for being here, Rebecca.
Oh, I'm so excited. I was so excited when you called me about this. I love this kind of thing.
Yeah, it's just super exciting. And I want to read your bio because I want everybody to know who you are and introduce you properly, and then we'll get started. Here we go. So, Rebecca is the National Corporate Training Executive for Zeo Skin Health, where she leads education nationwide for one of the world's most science driven skincare brands. With deep expertise in professional skin health and clinical education, she empowers providers to the approach of the consultation with confidence and a results driven, prescription based mindset. Passionate about turning complex science into practical strategies, Rebecca helps estheticians and medical professionals deliver personalized care that builds trust and transforms skin. Welcome, Rebecca. Thank you so much for being here today.
Thank you so much.
If you would like to purchase any ZO products, we have the affiliate link in the bio. So you can just click on that and you can purchase any ZO product directly from myself. So that would be great. We'd really appreciate it.
Brandy and I both have had the joy of working with Rebecca and attending her training courses in California and in Arkansas. So it's fun that we have that connection. So, yeah, it's really exciting. Brandy is in Little Rock, and then I'm here in California. And yeah,
Brandy, I'm going to be back in Little Rock end of October.
Awesome. I'm coming to see you. I had the best time at your last training. That was so much fun. I loved how
Oh,
you broke everything down and it was just fun. It was like, it wasn't boring, a whole bunch of science. It was things that I could relate to. So you were great. So I'll
fantastic.
be back for sure.
Okay. Looking forward.
yeah, yeah. I've always had fun at your training courses also, and I'm so glad that you're here to share your expertise for sure. I've always am so happy to go because they're so organized. You do such a great job at organizing your classes, and I always walk away with so much knowledge. I've been working with ZO for many, many years,
Yeah.
and I think I pretty much have this down, but no, every time I learn something new every time. So I really appreciate that. Thank you so much for always bringing a fresh approach to what we've been doing in our industry for a while. It's very exciting.
Thank you. I just love this industry. Just the way that my career has grown from I think I want to do this to doing this to then being in training. I didn't really anticipate it going to this particular direction, but you ladies are making me feel real good about the decisions I have made.
I'm curious, what did draw you to the field of medical aesthetics?
So I've always been into skincare. I've always been into the beauty industry in general. And I noticed that the most beautiful people had the nicest skin. That's something I always paid attention to. However, I had zero interest in being in a dark room with quiet music and massaging someone's face. So it never occurred to me to become an esthetician until 1992. My aunt had a CO2 laser resurfacing, and she did her recovery at my mom's house. And I could see her every day recovering from that surgery or that procedure and the changes it was making because she was a sun worshiper in Southern California. And she told me that before her treatment, she had to go into the office 6 weeks in a row to have a lighter treatment and use a protocol to prep for that procedure. And I said, oh, whoa, pump the brakes. You had a facial treatment done in a plastic surgeon's office? She said, yeah. And I said, that is going to be what I do. And it just didn't occur to me that that was an avenue. So I've been playing with my skin since I was 4 years old, doing little facials with my grandma, watching silver screen movies and setting our hair. And I figured out, oh, there's an actual fix the skin end of this industry. And it took me a few years. I was a young mom at the time. So it took me a little years to get into school. By 99, I had that license and I was ready. And I went straight into plastics. I never looked back.
That's
That's wonderful.
awesome.
Yeah.
So, with your vast knowledge of all the different types of medical grade skincare, what made you choose ZO to work
Science.
for?
Science. If you use it, then it works. I like an if then kind of life. If this is good, this is good. If this is bad, this is bad. I parented that way. And I liked to be able to use something that it wasn't a guessing game. The work had been done, the science stood on it. I could have beautiful before and after pictures that matched the ones from the company. It wasn't just that one picture and that one glorious patient that had good results. It was every single one. And I saw the changes that this brand could make. And I had the pleasure of, in the beginning of my career, working and studying under Dr. Obashi. And that just kind of was like that light bulb of not only did I side medical aesthetics, but I decided best in the medical aesthetics. So I've stayed there. I've stayed there and I've had opportunities to, look at, research other brands, and I come back to Zio always, always, always.
Yeah, us
That's
Science.
too.
awesome.
Brandy
Thank
and
you.
I.
Yeah.
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 We can't get enough
So
of Zio. We love it.
you
We love it. Yeah, it's changed my skin. I mean, so I have that story that I can tell people as well, and that's so important to be able to use the products that you're using on them.
right.
So,
Well, and I think that if you can make a difference in how someone hits the world, it makes a
mhm.
difference in their emotions, their mental, their confidence. And I really love that the medical aesthetic sides of things is that focus on creating a healthy, vibing organ, not just the pretty parts. We're not just going to cover up and band aid the surface. We're going to go after the source of the problem. And we're going to help to give you that, whatever it is that you need. Keep it good, make it a little better, make it the best, correct something, whatever we can do. But I like this part of the business.
It's wonderful. Now that we're kind of getting into the heart of what we do in the medical aesthetics field, let's get into the prescription pad and
Oh,
also
yeah.
get into the consultation. In your opinion, what makes good consultation a good consultation and a bad consultation?
A bad consultation is making assumptions. It's looking at someone when they walk in and making an assumption of what you think they want. It's not always the obvious. Sometimes it's this tiny little thing. I had one patient who came in the door. I said, all right, I know why she's here. Face full of pigment issue. No, she cared about a chickenpox scar on her jawline that she'd been teased about by her brother as a kid. This was all she saw when she looked in the mirror. I had to get in close to even see what she was talking about. But the good thing is that if I help you with that chickenpox scar, all the other things are going to get better too. But don't make assumptions and don't rush. The trying to do a comprehensive consultation in 5 minutes is a bad move. If you don't give value to a complete consultation, you're not giving value to that patient. You need to actually answer the full question. And you can't answer the full question until you dig some of those things out of them. And if they come on your table and that's the time frame you have, and you're trying to do a quick consult while you're working on them, do not do a silent treatment. Hands on treatments can be vocal at the same time. You're in a professional space making an assessment. You can ask questions throughout that. And then you can say, we're going to get you started here, but I need you to come back for a follow up complete consultation. You need to finish the questions. And when you don't, you have patient turnover immensely.
Yes. And then also
That's
to
good.
write it down for them, correct? With the
Write it
Zio
down.
pad for sure. Yeah.
Yeah.
Write it down. If you're not writing it down, they're not going to remember it. I
Mm-mm.
don't remember what I'm buying at the grocery store if I don't write it down.
Yeah,
Yeah.
exactly.
And I would say that that really elevates the esthetician or medical provider from service provider to a trusted expert. So I think that that is just so important to do. Use the pad and
Use that.
you have it. You have it. Use it.
Yes.
Yeah.
And when you're writing that down, what you're providing, and these are kind of words that I try to teach providers, you are a provider. I don't care if you're an esthetician, a nurse, an MP, a PA, an MD, you are a provider in a medically supervised setting. That means there is discharge paperwork, there is written prescriptions. If you go to the doctor and you leave there with nothing written down, no prescribed thing, just go, I guess, off to the drugstore and find something that works. They gave you a diagnosis, but no help. That
Hmm.
would not make you feel confident. That would not make you have trust in that provider. So when you are the person that's being asked for help, and know that if someone came to you, they're asking for help. You didn't go and knock on their door and be like, hey, my name's Brandy. And I thought that I would just come see how you're feeling about your skin today. They came to
Yeah.
you. They
That's
gave
right.
up their valuable time and walked in hoping for answers. They don't always tell you the whole answer the first time. So really digging it out might be helpful. But that prescription pad, it ignites the thought on there's 75 products here. My provider chose these ones for me for a reason. But also, what is this other product? Do I need that? That answers the door to, do I need more? You're ready to elevate? Me too. Me too.
Yeah.
Yeah. What do you one problem or issue, I guess, that Brandy and I both have had being spa owners,
Mhm.
and with our estheticians, sometimes they feel like they're being too salesy. They don't want to be too salesy. Do you have something that you say to estheticians that have that concern?
I love this because some people do come from a retail background and they don't think anything about selling. That's easy. Some people do not. And that's where they're like, oh, I don't want to push product on my patient. They came in for a treatment. And that's where their knowledge is lacking. Knowledge is power. And if you have knowledge, you have confidence and you will say things with a confident way. The other part is doing that consultation, a complete consultation. Ask questions like, how long has this been bothering you? What else have you tried? Are you frustrated? Do you feel like you've wasted your money? I'm here to help you. I'm going to guide you. I'm going to be your partner in this journey. But because you said, you cannot have this answer unless you ask questions. Because you said you didn't like your texture, I chose this product. Because you said your brown spots bothered you, I chose this product. Because you said I need some of this, I chose this product. Because I chose. You're not selling anything. You're answering what they said they didn't like, what they wanted to concentrate on. And sometimes because I see XYZ, and I know the source is too much oil. I need you on some oil control, or we won't be successful in the rest of your program. So it's okay to throw that one extra thing that the patient didn't know about in. But if you start from a because you said, I chose, and then you pull every product forward because you said you didn't like your brown spots, I chose this product because you said, because you said, because you said. And then that does not feel salesy. That's like, yeah, that's what I asked for. You're right.
Yeah, exactly.
And that's
And
where I
what,
really lean on.
yeah, and
That's
once
good
they
stuff. Yeah.
try the product, they're going to love it. They're going to come back and get
Mhm.
more. Yeah, so that's wonderful. Thank you for that advice. That's really good.
That prescription pad has every product. Write down everything that they should be taking today. That's the full protocol. That's good, better, best. You give them the full answer. And if they say, that's too many steps, say, okay, well, we can start with a better version. This is the best case scenario. We can start with a better version. We don't want to overwhelm you. We'll start with the fundamentals. Well, but what about the one for my brown spots? Well, we're going to give you less steps. We're going to build that trust. You can come back next week for that. The minute you give an option to someone and then you take it away,
Mhm.
honestly, it's psychological. But wait, you said I needed that. You do. But you told me that was too much, too many steps. My answer didn't change. Your commitment changed. Oh, no. I'll do that. And if you just let them make the decisions, the steps, the money, all of that, that's none of your business. You give the full answer. And that prescription pad prompts you to not forget anything, including your eye products, your body products, your treatment recommendations. So I just wanted to throw that in.
I love that. That's so good. And yeah, probably the minute you take that away, they want it. And they're
They
going to
want
be
it.
thinking about it. As soon as they get home, they're going to figure out how to get the money to come back and get that. So that's
Exactly.
so good. How do you teach providers to move beyond surface level questions and uncover the real concerns or goals clients may not even articulate at first?
I like to listen to what's not being said. I like to watch body language. How does someone walk into your space? Do they make eye contact? If
Hmm.
they don't have confidence. If their arms are crossed, are they open to answers or are they nervous? Are their arms crossed because I've already heard this before? I've spent thousands of dollars, that kind of thing. So I like to listen to what's not being said. When someone says, I want help with XYZ, sometimes I say, why now? What's coming up?
Yeah.
This didn't get here last week. This has been going on for a minute. You didn't get a wrinkle 5 minutes ago. If this wrinkle suddenly bothers you now, why now? And that
Oh,
drives
that's good.
sometimes a
Uh-huh.
personal answer
Hmm.
that they didn't plan on sharing with you. But maybe it's they've got a wedding coming up, they've got a reunion coming up. They're going to get out there on a dating site and they want to look their best. Maybe they
Uh-huh.
saw a picture of themselves and they said, "Oh, no, I don't like that." But asking why now? Why now? I mean, unless you're 7 years old, you're coming in because something has been there more than a minute. So
Yeah.
I feel like that body language and what's not being said, and then I love a why now kind of a question. It's not an open-ended question. It's not a yes or no. You got to tell me more.
Yeah, I love that. That's so good.
Yeah, the why now, that's
Definitely gonna start
great.
using that. Yeah.
So, Rebecca, as the national trainer at ZO, you've seen providers, estheticians, and medical providers at every stage of their career, I'm sure. How does mastering the protocols of ZO change the confidence of that esthetician or that medical provider in the treatment room, mastering those protocols?
Really, there is no one product that speaks to every cell in the living organ of skin. We have multiple cells which have different receptors for different ingredients, which means it's not a one and done. So, a protocol, first of all, believing that to be true, that there is no one magic thing, really understanding that a protocol is where the magic happens, that we have to start with the fundamentals of cleanse, exfoliate, tone. We've got to keep that skin turning over, keep that surface oil out of the way. Then our products can get where they're trying to go. The treatment products people want can't get past a bunch of oil, can't get past a bunch of dead skin cells. So we want to make sure that we're starting the program off right, understanding that protocol is fundamental to answers, really. And if you don't know it, you don't sell it. If you
Mhm.
don't master those protocols and you don't try it yourself, you will never say it with confidence. You'll be like, yeah, so here's this protocol and you should use it. But if you don't say, we're starting with the basics. We're going to increase our steps based on what you've asked me for. I'm going to put in what you need. I'm not going to add what you don't. And this is going to be customized to you. But if you don't believe it, you will not say it. You will think, oh, they'll never buy this. I can tell you right now, there is no patient I would ever see that I would say, but if I just wanted one thing, here's a kit. A kit is one thing. That's $1. We're going to start there. But there is no person who I would let them skip over the basics that I know are game changers from day one. And I know that deeply in my heart because I've seen it time and time and time and time and time again. And if you do not know this, you will not say it with confidence. So the first step is put yourself on a protocol, take your own pictures, have your own pictures at 2 weeks, at 4 weeks, at 6 weeks, at 3 months. Be your own advertisement. And if you think of it from a perspective of my own commitment to a protocol is going to be my success, it doesn't feel like fake anymore. It doesn't feel like I have to memorize this whole protocol or I'm going to fail. It's not all or nothing, but it is the fundamentals or nothing. I mean,
Yeah.
that's kind of where I challenge the provider that doesn't use the protocol. Then how do you expect to be
Mhm.
successful?
Yeah.
Exactly. Brandy and I talked on our last episode. We talked, or a couple episodes ago, actually. We talked about don't fake it till you make it. That's terrible advice, like the worst advice we've
Real
ever been
advice.
given. Fake it till no, there's no fake. You educate yourself, and
Hmm.
then you're able to do it for real. So yeah, that's great. Thank you so
Yeah.
much for that.
Yeah.
Yes,
Knowledge is
that is
100%
good.
power. Like you said, Laura, I love this because you and I have spent some time together. And I love that you're like, no, I know this. It's just going to be a nice refresher. And then you take something away. I was just at a big meeting with the whole company, and I learned something new from somebody else. I'm the one out there teaching, but I can always learn. I'm always going to learn one liners and a little bit of science and this and that. But I study this stuff. You should see my search history is all
Yeah.
science.
And that's what makes you successful. I mean, you're constantly learning. You have to learn something new every single day. So yeah, that is so
And
good.
also have your protocol book.
For
Have your
sure.
book.
Yes.
I don't care what company you work for. I will speak to ZO, but every company that you bring in a product into your practice, I mean, I hope for my sake it's ZO, but if you choose XYZ brand, they've got some sort of educational material.
Yeah, for sure.
Keep it handy, learn it. Always have that at your ready. Otherwise,
Mhm.
you're not going to learn it. You have to invest in yourself as a provider. You can't wait for
Mhm.
someone to just be like fall in your lap and be like, "Here's my whole wallet, take it." You have to be able to educate yourself so that you can give that confidence.
Yeah,
Yeah,
I
they
love
come
the
to us.
flip chart. I have the flip chart right here. This thing is amazing. I
Yes,
Yes,
love the yeah.
you
the
need
best
it. I
before and
mean, I've got
afters.
brochures. I seriously have prescription hands at hand's reach, prescription pad. I've got brochures. And this is my house. I'm not even in an office, but I
I
don't
love
go
it.
out of my house without those things. And I'm studying constantly.
That's
Great.
great. I love
Was one
that.
thing that we've talked about in the past also is, being a master of in your field. They're coming to you
Mhm.
because you are an esthetician. You went to school and you did advanced training, and it
Yes.
shows. And show it off. Show that you know how what the functions of the skin are and how things work. So that's really wonderful. Yeah.
And honestly, I feel like so many people don't really know what estheticians do. They
Hmm.
think that we do facials, and I like to teach words because words have power. If you are in a medically overseen practice, you don't do facials, you do treatments.
Hmm.
Oh, I
Frame
love
it
that.
Yeah.
properly. I could get a facial at the, massage place down the road. That is not the same as an expert provider treating the biggest organ of your skin with full understanding of cellular function and skin histology. Nurses that are doing injectables or lasers, they know their stuff. They may not take the time to study the things that we do. And for me, I
Hmm.
have no interest in going into other parts of this industry that would allow me to do various things just because of my title if it took away from treating skin like skin. So for me, the skin is amazing. We can trick it into healing. We can wound it and it heals. We can strengthen it. We can just poke it and make it do what we want. I'm obsessed with skin. Obsessed.
Skin is great. I love that. That's so, yeah, I love that. I'm going to start calling it treatments. I don't do facials anymore. I do treatments on the skin. Okay. I love that.
When you're making a treatment plan for your patient, that includes a complete protocol that is always going to be adjusted. Don't Our
Okay.
skin doesn't stop changing until the day we pass. So we're going to start here. We're going to reevaluate at a
Hmm.
follow-up, and we're
Yeah.
going to make a complete treatment plan. I need to see you in the office in XYZ amount of time to follow up. This is a non-negotiable. You're making a partnership with someone. And if you go to the doctor and they say you have to have a follow-up, does that feel negotiable? No. You're like, let me get on my calendar. Okay, yeah, I can make that day happen, or can we move that out a few days? But when you make a whole treatment plan, it is part your job as the provider to follow up, to reevaluate, to change a protocol. And it could be just from 2 pumps to 3 pumps, change the layering of something, add in something, take away something, whatever. But that's how you keep a patient for decades. That's how you keep them. You treat it as a treatment plan. You use your prescription pad, you create a protocol, and there you go.
Yeah.
Awesome. I love that.
I love it. Yeah. Preach.
Yeah.
You're
Yeah.
you're preaching to us. I love it.
Yes.
It's perfect.
Preach.
That's what.
I
Monday.
love it. I love it. This is what we needed. This is exactly what we needed.
Yes.
So, Rebecca, if you could give one piece of tried and true advice to providers who want to feel more confident during consultations, what would it be?
They already like you. They came to you. Stop having imposter syndrome. I mean, I feel like a lot of providers, we feel confident until someone asks us something. And then we're like, am I an imposter? No, you are glorious and smart and driven and chose this for a reason. So believe that they already trust you. They already want what you have to offer. You, again, did not go knock on their door. They had to find you, schedule, get in their car, drive through traffic, find a parking spot, give up part of their day, turn their phone on silent, have a consultation with you. They came to spend money and they came for answers. So stop
Love
worrying.
that.
Yeah.
Stop.
Amen.
Like, the confidence comes from knowing they walked in the door. They're already in. If this is your business to gain or lose, that you're
Okay.
already on the winning side. You're already on the winning side. If you don't do your job, you will lose them. If you don't do a proper consultation, you will lose them.
Hmm.
That's on you. If you don't do follow-ups, you will lose them. And the person down the road who does do that continuous touch point, that follow-up, that protocol change, that advancement, that's who's going to keep that patient. But if that patient comes to you, maybe they already left another place that they didn't get that from. So it is your job to believe them that they want you.
Love it. Thank you. That was awesome. I needed to hear that. I think everybody needs to hear that. It's just good to be reassured once in a while. I think we all have that imposter syndrome. It's so easy to get in your head and start thinking, no, maybe they don't. Or they walk in and you're like, oh, they probably can't afford this. Never, ever think that. Never, ever judge a book.
Never, because like you said, when you tell someone you need these things and then they're like, no, they're going to think of how to get it. I will find, we all have our budgets. We all have those times where today it cannot happen. It literally cannot happen today. But now I know what I'm going to give up that extra coffee in the streets for. Now I know I'm not going to buy extra shoes this week. Now I know I'm going to wait on something else that can wait. I'm going to, not go homeless. Be smart, but
Yeah.
I'm in the I'm gonna find the money for things
Yeah.
that are important to me. And I will never find the money for a brand name handbag ever, but I will always find the money for my skincare.
Yeah.
Always.
Yeah, same, same.
Love that.
Yeah, wonderful. Rebecca, thank
I
you
love
so
that. Don't
much for
judge the book.
joining us. Yes, yes.
You're so welcome. Thanks for
Yes.
fun.
Yeah,
Yeah,
this
is
has
there
been
anything?
fun. We'll have to have you back because you're good for me for sure.
Thank
Yes.
you.
Oh my gosh, you're a breath of fresh air and so much knowledge. It's just been excellent. Thank you so much. Is there anything you'd like to add today or?
I feel like these days people are really stressed and they got a lot on their minds. And from work things to home things to world things. And I think that if you're in this industry, it is a service industry. We are giving of ourselves. And if we are empty, we have nothing to give. So every day you walk into that practice that you chose, this is my baby, this is my job, this is my life. Every day, leave life at the door, do something that makes you grounded and ready and thankful and grateful to be where you are. It might not be the best day across the board, but it is a day. Really taking that as, and sometimes I physically like shake things off of me. Like I just leave it in the parking lot. Physically, whatever will make me do that. But find something on the way to work. Do not listen to talk radio if it depresses you. Listen to your hype music, whatever. But every day that you walk in, be ready to give because that is your job. And if we're not in the giving space, we're not going to be successful because our patients and our clients, they come for something from us. And that can be exhausting for sure. But know that this is what you chose. And it's a beautiful, beautiful thing to be able to give confidence to another person simply by your knowledge and your patience and your time. So honestly, really walking in every day with that ready to give feeling is how you're going to be successful.
Yay.
That's
Oh
wonderful.
my gosh. That was so
Yeah,
good. Yes.
really
I
good.
love
Yes.
it.
And
Yes.
every week we do a tip of the week, and I think that was the tip of the week right there. Thank you, Rebecca. That was wonderful. That's
Yeah.
all
I
all the
agree.
estheticians out
Hard to
there
top
need to
that.
hear that. No, yeah, we can't top that one. So I
Yeah.
really appreciate that.
No.
Thank you so much. It was lovely having you
Yes.
today,
Thank you so
Rebecca.
much for
And
having me.
yeah, thank you so much. And we'll see you all next time on Pretty Smart too.
Bye.